Acute myelocytic, that is, myeloid, myelogenous, myeloblastic, myelomonocytic leukemia is a life-threatening disease in which the cells that normally develop into neutrophils, eosinophils, basophils, and monocytes become cancerous and rapidly replace normal cells in the bone marrow. Acute myelocytic leukemia is the most common type of leukemia among adults, although it affects people of all ages. In AML, immature leukemia cells rapidly accumulate in the bone marrow, destroying and replacing cells that produce normal blood cells. The leukemia cells are released into the bloodstream and are transported to other organs where they continue to grow and divide. They can form small masses or chloromas in or just under the skin or gums or in the eyes. That is, they may be subcutaneous. Acute promyelocytic leukemia is a subtype of AML. In this subtype, chromosomal changes in promyelocytes, cells that are at any early stage in the development into mature neutrophils, prevent binding and activity of vitamin A. Without vitamin A activity, normal cell maturation is disrupted and abnormal promyelocytes accumulate. The final symptoms of AML are very similar to those of acute lymphocytic leukemia. Although meningitis occurs less often than in acute lymphocytic leukemia, AML cells can cause inflammation of the layers of tissue covering the brain and spinal cord meninges, as well as the polymorphonucleus. The diagnosis of AML is also similar to that of acute lymphocytic leukemia. A bone marrow biopsy is almost always performed to confirm the diagnosis and to distinguish AML from other types of leukemia. Without treatment, most people with AML die within a few weeks to months of the diagnosis. With therapy, between 20% and 40% of people survive at least 5 years without any relapse. Because relapses almost always occur within the first 5 years after initial treatment, most people who remain leukemia-free after 5 years are considered cured. People who have the poorest prognosis are those older than 60, those who develop AML after undergoing chemotherapy and radiation therapy for other cancers, and those whose leukemia evolved slowly after a period of months to years of abnormal blood pressures. Treatment is aimed at bringing about prompt remission, the destruction of all leukemia cells. However, AML responds to fewer drugs than does acute lymphocytic leukemia. In addition, treatment often makes people sicker before they get better because the treatment suppresses bone marrow activity, resulting in fewer white blood cells, particularly neutrophils. Having too few neutrophils makes infection likely. Meticulous care is taken to prevent infections, and that may occur, which is promptly treated with antibiotics. Red blood cell and platelet transfusions are invariably also needed. In myelodysplastic syndromes, a line of identical cells or clones develops and occupies the bone marrow. These abnormal cells do not grow and mature normally, resulting in deficits of red blood cells, white blood cells, and platelets. In some people, red blood cell production is predominantly affected. Myelodysplastic syndromes occur most often in people older than 50 years. Men are more than twice as likely as women to be affected. How's that?
That was fun.
Are you now a master of acute myelocytic leukemia? So if they say that this is simplified medical, what's complicated? I've been looking around for a book that says this is only complicated medical. I don't want to simplify.